It's Nate with Pulse PMF in the PulseCast booth at the 2025 Biohacking Conference. And joining me today is Hans from Oxy Health. Thank you so much for joining us today. And this,
Thanks for having me.
absolutely. Now, hyperbaric oxygen therapy, I think a lot of people have heard of it, but they don't actually understand what it actually is doing. People maybe recommended it, and I'd like for us to go there at some point. But let's start with the origin story of Oxy Health. How did you come into the company? How did the company get launched?
Absolutely. Yeah. So in the 90s, the late 90s, Oxy Health invented and pioneered the portable chamber that's FDA cleared for clinic and for home use. So our founder, Samir Patel, his goal was to bring hyperbarics to the masses and take the mysticism out of the therapy. So hyperbarics, more baric pressure, so increasing barometric pressure to allow exponential levels of oxygen saturation in the liquid portion of your blood system. So plasma saturation,
Yes.
independent of your red blood cell. But having a home chamber has been shown not only to be effective in research, but in addition to that, it's exceedingly safe. And so we have the most impeccable safety record out of any hyperbaric provider.
Wow.
And we have thousands and thousands of folks worldwide that are using our equipment.
And so you are the vice president of Oxy Health.
Correct.
And how did you come into the company?
Craigslist.
No way.
They were looking for a copywriter back in 2013. And I said, "Oh, I could do that." And I went to school for writing, and I could talk a little bit too. And then within 90 days, I was swiftly moved into sales. Then I became the sales manager, and now the vice president.
Wow. And so since Oxy Health really pioneered a lot of the hyperbaric movement, what has been the evolution since the late 90s as far as your products are concerned and getting implemented into existing practices and home use?
Yeah. Well, the number one thing that Oxy Health is all about is research. Now, anybody
Yes.
can say anything about anything. And we do a line in terms of, there's no false hope and things of that nature, but there's a lot of new and great research that is using hyperbarics for off-label indications.
Yeah.
Pediatrics is actually what put Oxy Health on the map in the early 20s.
Really?
So there was a lot of physicians that were using hyperbarics for neurodevelopmental delays in several different categories
Wow.
for young children. And so, interestingly enough, in 2014, the UHMS, that's the Undersea Medical Society, and they published a research paper actually using our equipment as well. And they were looking at gross motor function improvement in kids with cerebral palsy. They did 40 hours within 30 days, which is the typical gold standard. The interesting thing is that there was no significant statistical difference between a portable chamber versus a hard-sided steel chamber with 100% medical grade O2.
Wow.
And it was hyperbaric air. So it was mild pressure, 1.3 atmospheres, compressed room air only, compared to 1.5 atmospheres and 1.7 with 100% oxygen and no significant statistical difference. And it was 150 kids, and then it was a longitudinal trial, so an 8-month follow-up, and those were lasting results.
Wow. So can you share some of those stories, those success stories of when Oxy Health brought a life-changing breakthrough for a family or a friend, maybe even somebody that you know?
Well, for example, what put Oxy Health on the map with sports medicine? It was Terrell Owens. So back when Terrell
Okay.
Owens was on the Eagles and he had a fracture on his foot, and they said you're out for the rest of the season. He was really bummed. He was confident that they were going to go to the Super Bowl, and so he was using several modalities, but he did contribute or attribute our Viteris 320. That's our flagship model. He attributed hyperbarics as a huge method for him to recover, and he recovered. It was the fastest fracture recovery in NFL season history. He was able to
Wow.
play in the Super Bowl and ran for over 100 yards.
Whoa. And how quickly was that recovery?
That recovery was within a 3.5-month period.
Wow, that's amazing. So since we're at the biohacking conference, it just makes sense. So let's talk about stacking Oxy Health
Sure.
with other modalities.
Absolutely.
What have you found are the best modalities to stack with your products?
Well, there are. Red light is a large complement of hyperbarics. There is research on that for wound healing protocols and things of that nature.
Yep.
But even for PEMF, there's a lot of, it's all about increasing circulation. As we all age, we have compromised circulation.
Yes.
And so, a hyperbarics from a wound healing standpoint induces angiogenesis, so the creation of collateral blood flow when there's blockages and things of that nature and chronic inflammation. But even for a lot of physicians, they will stack like a PEMF pulse, with hyperbarics. They'll do it. I'm not all too certain as to what the physician protocol would be for that
Right.
specifically, but I do know that it is a common combination for PEMF, hyperbarics, red light, even a telomerase activation capsules and everything. There was a study that was done in Israel where it showed 60 sessions over 90 days lengthened telomeres. And
Okay.
so it's
The anti-aging properties as
exactly
well.
right.
Wow. So when you're talking about now, obviously every body is different. So everybody's there's no cookie cutter protocol
Correct.
for something like this. But let's just, for example, start with people who are looking for maintenance, just to improve the quality of life. Maybe they don't have a debilitating issue. How often do you recommend that someone engages in an oxygen therapy like Oxy Health?
Well, if it's a lifestyle approach, typically physicians recommend about 3 to 4 treatments a week. And
Okay.
so, and it's about an hour exposure each time. 90 minutes are popular. 2 hours would be typically the max. And so, what the research has shown, even with just compressed room air only, at mild pressure 1.3, there's a minimum 50% increase in the blood plasma oxygenation. And they found that
Wow.
to be quite notable because if one microscopic red blood cell has the capacity of holding over a billion with a B, over a billion oxygen molecules, and then you
Wow.
increase that systemically by 50%, it's quite notable. And it wants to go to the brain first because the brain is calling for the vast majority of all of the oxygen in the body, 24%. It's especially with enhancing cognition. There was another study that was done in Israel where it was enhancing the cognition of healthy older adults.
So, since we're living in an era where a lot of us are in front of steering wheels, we're hunched over our laptops, we're not breathing the way that we used to when we were more active people. The more the sedentary lifestyles are setting into this generation, it's affecting our oxygen levels in our body for sure. So, what would you say to the everyday person who's maybe just not feeling like they're optimized? Would this be something that you would recommend that they try?
Well, the research has shown that oxygen is primarily metabolized in mitochondrial. So your
Yes.
mitochondria, obviously the powerhouse of the cell, that produces your ATP, adenosine triphosphate. So if you increase the oxygen tension in the blood that's metabolized in mitochondria, you have an upregulation in ATP production. So you have more cellular energy. The more recent case report that was published out of the University of Wisconsin that did use our equipment as well, portable chamber, 1.3 air. They had 10 healthy volunteers complete 10 90-minute exposures over the course of 2 weeks. And there was a threefold mobilization in stem cells out of the bone marrow.
Man, it just goes to show the interconnected, holistic nature of the body. It's so fascinating. When you are trying to improve one area, it ends up improving multiple areas
Exactly
at the
right.
same time. So you have devices for the like wellness center, the wellness practitioner or doctor. You also have the home units as well. Can you talk about some of the offerings that you have at Oxy Health?
Absolutely. So, I mean, the portable line is really just small, medium, large, and so if someone is petite, then you don't have to get the big one.
Well, that's so good because some people get choice paralysis, right? When there's too many choices. So I like that. Small, medium, and large. That makes it easy.
Yeah, and so then, but then it gets a little different when it goes into our hospital grade steel model.
Yep.
So that's for the clinician, hospitals, and the private practice, the freestanding hyperbaric facilities. The nice part about our equipment is that it's an air over oxygen delivery system. So it's pressurized with ambient air, and then you supplement medical grade O2 to the patient in the steel model. And so, but that eliminates all the spark risk because you're not pressurizing the entire vessel with 100% oxygen. So now you're managing all of those risks and it's already been mitigated for you.
So, can we talk about even like pricing on like the home unit? So, say somebody's watching and this is piquing an interest because it does affect so much of the cellular function of the body. For home users, this should be a no-brainer. So, what does that look like for the home user, and how can they find out more information?
Absolutely. So, I mean, it's small, medium, large. It's 9,000, 15,000, and 23,000. I also recommend rent it. We have a rental program.
Wow.
And so
Okay.
it's so if one wants to rent, like the mid-size model is quite popular. So that's $1,500 a month and up to 3 monthly rental fees, and your security deposit of $2,000 will go towards the purchase price if and when you decide to keep it. And so,
Okay.
and the minimum rental is just 1 month. And so it's you can find more information at oxyhealth.com, oxyhealth.com.
Awesome. And because you are the pioneers of hyperbaric, it's probably safe to say that if someone's offering hyperbaric services in their area, they probably have an Oxy Health system.
Yeah, we're the number one provider in the world.
Wow.
And we have the best safety record, and we make everything 100% in the United States.
And for those who are watching your social media, how can they stay connected with you?
Just at Oxy Health, OXYHEALTH.
Instagram, Facebook, and all of that.
Oxy Health.
Man, thank you so much, Hans. I really appreciate you
appreciate it,
joining us on the
absolutely.
PulseCast today. We're at the intersection of impact and innovation. These are real voices driving real change. Have hope, because this is the generation where everything is turning. What we have believed before, we're all asking the question now, what if? What if there's new possibilities? What if there's a way to reverse? And it's pioneers like Oxy Health that is making the change for this generation. So follow them on social media, find us on PulseCast, and we'll see you in the next conversation.